Carla, your online doctor, with today's Live in 5. Today is Thursday, November 19th at 5 p.m. So we started talking on Tuesday about the mistakes people are currently making in regards to spreading the COVID virus and during this pandemic currently. Okay, again, it's not washing your hands enough or occasionally spotting somebody with their mask under their chin. There's a lot of other factors that are causing this pandemic to continue to spread. So look at my live from the other day to see I had posted mistakes 1 through 4. Today we're going to talk 5 through 9. Okay, so mistake number 5 on the list: believing that because something is allowed, it must be safe. Well, that's like thinking just because it's on the internet, it's true. We know that that's not necessarily the case, right? So things are being done every day here in the United States that are allowed, but are far from low risk. Okay, so safe and low risk are not necessarily the same thing. So just think everything on both sides having to do with the election, rallies, protests, etc. There's opening bars and restaurants, nightclubs. Crowds are crowds, whether they're indoors or outdoors. So just because they're allowing things to be open doesn't mean that they're low risk. It doesn't mean that they're safe. In addition, just because they close things down at 5 p.m. and put curfews on things doesn't mean that from the hours of noon to 5 p.m. it's safe, but we're closing it at 5 p.m. because after 5 p.m. all the COVID people come out. I mean, seriously, people, this is not like vampires where they come out at night. So understand that just because we say, sorry, my nose is itching, just because things are being done doesn't mean that they are low risk. Mistake number 6: thinking coronavirus precautions are single action items that only need to be done one at a time. Okay, that's actually a big mistake. People are just not thinking about layers of protection. One layer of protection on top of another just improves your chances of being safe. So one layer is wearing a mask, right? Another layer is physical distancing. So people who say masks don't prevent you from getting sick, yeah, you may be right, but it's going to decrease your chance. And then if you social distance on top of that, you're decreasing your chance of getting it even further, right? Another is only gathering in outdoor environments. So now if you're outdoors wearing a mask and social distancing, you've added 3 layers to your protection, which is going to improve your chances of not getting the virus. And another layer is minimizing the time you are in close contact situations. So if you get into an elevator and they allow 4 people in the elevator, but you're only in the elevator for 10 seconds, can you get the virus? Yes, but if you stay in the elevator for 3 hours, if one of the people in the elevator has it, your chances are higher, right? If nobody has it, doesn't matter how long you're in the elevator. But again, I'm just making an analogy that would be easy for you to understand. You're in a closed space for short periods of time. Your risk is still low, although not non-existent. Mistake number 7: ignoring the reality that things are going to continue to be different for a while, and a while may be a long while. Okay? Every time we ignore this reality and pretend this virus has gone away, we get kicked in the booty, right? The more it will literally come back to bite you, the more you ignore the reality that this virus is out there. Okay, I watched something on TV today which shocked me, where doctors are talking to family members and patients who are in the hospital very sick with COVID, and the family still just doesn't believe that COVID is real or that COVID is going to be a problem for them. That's a problem. There's a problem that people are denying the fact that this virus exists. Whether you believe the extent of it, the false positivity rate, the whole thing. I mean, that's fine. You don't have to believe it all. But I mean, these patients were in the hospital getting treated for pneumonia and still in denial. That to me just blows my mind. Okay. Mistake number 8, thinking your friends and family are as careful as you are about protecting yourself. Okay, recent studies suggest if it is fairly common for people to be dishonest, yes, people lie, about their precautionary measures in regards to the COVID virus, and even to try and hide it when they are sick. Now, whether there's a stigma that you got COVID and you did something wrong, I don't know. But seriously, at that point, if you're sick and you're hiding it from your family and friends and continuing to be in contact with them, well, shame on you. Okay, if you don't want to tell them you're sick and you make up all kinds of excuses to not see them for 2 weeks, that's fine. But protect not only yourself, but protect other people, especially once you know that you are infected. Okay, one study showed 1 in 4 people, 25%, were not honest with others about how they are social distancing, and more than half of the people surveyed who had the virus said they hid their symptoms from other people. Now, in the study, they didn't reveal if those people lied about their symptoms or positive testing and actually put others at risk by going into public places, or like I said, or if they stayed home and just didn't tell people. Because I've had a couple of friends who kind of went MIA, like you can't reach them, you can't reach them by phone, they're not really communicating with you, and then a couple of weeks later they come back and say, oh yeah, I had COVID. You know, don't know. I don't understand why people would do that. Again, I would like to support them if they're local, bring them something to eat, leave it at their door, whatever it may be, just to be nice and helpful. But, you know, different people react differently. But to lie about it and obviously put others at risk, well, shame on you. Mistake number 9, ignoring what the virus is doing where you live. Okay, if there are lots of cases in your area, your risk is higher than if the cases are low. I mean, that's just obvious. If you know the current situation where you are, you can clearly take added precautions. Okay, so there are plenty of websites and things that you can research to find out the cases numbers in your local area. And again, understand that if the cases are going up in your area, there's more people likely to have it when you go to the supermarket or when you go to Target or wherever you may go. Just means maybe go at less popular times, go on off hours, or do home delivery if you really just don't want to be exposed. And remember, it's not just the case numbers, it's the percent positivity. Okay, because there is definitely more testing going on day to day. So if today there's 1,000 cases, but there were 100,000 tested, it's clearly different than if 1,000 people tested and there were 2,000, 1,000 positives for 2,000 people. So you need the percent positivity, the number of positive cases relative to the number of people tested. So just an increase in and of itself is not enough to give you the full picture. But again, we do know that the case numbers are increasing in most areas. So look back on Tuesday's live so you can know all the mistakes and continue to be smart. Use your best judgment. Always try to do your best to keep your exposure to anything low risk to no risk, right? So again, on that note, I hope you're having a wonderful day, and I'll see you again Tuesday for another Live in 5.